Hi everyone, this is Dr. Jagdeep, and here we have with us Dr. Vishwa, who has secured All India ranking of 2119. Welcome to the show, Vishwa.
Thank you, Dr. Jagdeep.
So, before starting, first of all, introduce yourself to the audience.
Myself, Dr. Vishwa S. Police Patil. I have studied MBBS from Belgavi Institute of Medical Sciences, Belgavi, Karnataka. I was born and brought up in Yadgir district, Kembavi.
So, how was your financial condition in the home?
Financially, I come from a humble background, from a middle class family.
You had a financial support, or your family was dependent on your earnings
Uh,
mostly?
Most of the things, it was dependent on my earnings only.
Okay. How was your studies in your UG times? Like, did you study for a NEET PG specifically, or you concentrated on boards?
No, mainly I studied to make my concept stronger. I had been through most of the standard textbooks.
So, did you purchase any platforms for NEET PG preparation during your second year?
Yes, due to peer pressure, I have purchased it, but I didn't get that much time to study on that platform.
Fast forward to your internship days. So, how was the internship in BIMS Belagavi?
Actually, internship in BIMS Belagavi is really hectic, but it gives that much of exposure to the lots of patients are there because it is a bigger district in the Karnataka, so it caters almost around Maharashtra, Goa, and Belgaum completely. So I didn't get any time to study in internship. But I had cracked the UPSC CMS in my internship attempt itself. I had secured the All India rank of 232 in UPSC CMSC. And internship was like fun only. I had enjoyed also, but I didn't get any time to read.
So, you have cracked the UPSC CMS, or you didn't join the
No,
service?
because my calling was NEET PG, so I didn't join.
So, you rejected UPSC CMS
Yes.
to get into MD.
Yes, Jagdeep. That was the hardest choice to leave the central government offer.
First time when you wrote NEET PG,
Uh,
what was your rank?
First time last year I wrote in NEET PG 2024. My rank was 28,931.
Okay, from 28,000 to 2,000.
2000, yeah.
Okay, so that is a great leap. Anyone can dream of. When did you really actually started your preparation? Like really seriously?
Uh, After completing my internship, I started preparing for NEET PG 2024. That time, due to lack of guidance, because I didn't had any guidance how to study, from where to study, and all. And all those 4 years I read was only the standard textbooks and clinics. I had attended all the clinics, so I didn't know what to study, where to study, how to study. So I got a rank of 28,000, and then with the proper guidance from seniors, mentors, and all my professors from BIMS, and I prepared from August 2024. After that, then NEET PG 2025.
So let's start from the beginning of your journey.
Yes.
We'll start with the NEET PG 2024. Like how you were preparing after NEET, after internship.
After internship, because of I didn't had any proper guidance, so I studied only Marrow question bank and all. Once after completing NEET PG 24, writing the final exam, I came to know that it's not about reading everything. I should know only some certain specific set of repeat topics. Then I had made a plan according to that. I had a doubt also inside my head that whether I'll crack NEET PG 25 or not. What if I don't get if I lose this job also, and if I don't get any seat in the next year? Even I had so many doubts and questions. I doubted myself whether I'm able to do or not. Then with the right guidance and strategy, I made my mind that I'll be able to do that. And let me give one wholehearted attempt so that I'll not regret in the future.
So how was your study timetable scheduled from morning to night? How it was?
Morning, I used to wake up at around, I was studying at home, my home only, that is in Belgaum.
You didn't join any coachings like offline coaching?
No offline coaching. I had never attended any offline coaching. Morning, I used to wake up at around 9 a.m., like 8:30 in the morning. My day starts with around 9 to 9:30 a.m. 9 to 9:30 a.m. Initially, I used to study, revise the notes which I had made, and then I used to solve questions in between, like from 12:30 to 1 p.m. And then afternoon, I used to have a nap for 1 hour, and then I used to start with again with the fresh cycle of revision. and in the night again with the solving MCQs. Main thing which I done was solving MCQs.
Some people, they will make a chart in the paper, they will stick to the wall and then go according to like 9 to 10 this has to happen, 10 to 11 this has to happen. Or this was your approach, or like flexibility was there in your timetable, like
No,
it was in the mind?
I am not that kind of person. I should do this thing only at this time. I was flexible enough to do my adjust the timetable and all. But I used to have a like specific days for specific subjects. Pathology I should complete in 5 days. 5 days means 5 days.
5 days strict
Okay.
and
Yes, yeah.
if you couldn't complete one subject, then how was your approach? Like you used to go to next subject, or you used to linger to that subject only?
Initially, I used to linger to the same subject, but later on, I came to know that I should focus only on the high yield areas. I should not stick to the, I should not do PhD in only one subject because all 19 subjects are going to fetch me marks. So I used to shift to the next subject.
You told you have written INI exam.
Yes, that is.
So what was your ranking in that examination?
In November, INI had secured 8,000, and in May INI 2025, I had secured 6,000.
See,
Yeah.
rank was decreasing by day.
Yes, yeah.
Okay, so that means your plan was right, and have to be more efficient next time.
Huh.
During the downtimes, like the things are not going as planned. What was your strategy to deal with that downs?
During my period of lows, then I used to call my friends, seniors, and ask the right mentorship and guidance from the professors and all, like how to go about this, sir. Like I used to call my professors from the BIMS, and I used to take the advice how to go, and then I used to go accordingly. Some random YouTube videos and toppers motivation and all that I used to see in between. Can go for 1 or 2 days outings that I had gone also, and I used to watch a lot of movies also in between.
And during preparation time, did you join any jobs?
Initially, for 3 months, I had joined a job at Maratha Mandal College. But later, I came to know that I can't keep my legs on the both the boats, so I dropped the jobs.
For the NEET PG 2026 aspirants who are working right now, who are not having a nice financial background, what do you suggest? Like they have to work, or they should work and then read? What is your suggestion for them if they are working now and they can't avoid the job? Like they have
If they are financially really in a struggle, they can also work and read. But daily, at least they should take minimum 6 hours from their work schedule in the 24 hours. They can work for 8 hours. They can sleep for 8 hours, 16 hours. Another remaining 8 hours, at least they should study for 6 hours. 6 hours a day, and that too 6 days a week is more than enough to crack NEET PG.
resources you used during your preparation, and what do you think is worked for you and would have been much better?
I personally used individual subject specific teachers like anatomy from Ashwin Kumar sir, and pathology and microbiology from Preeti Sharma ma'am, pharmacology from Govindra Garg. I used the individual approach. Medicine I had studied from Deepak Marwa sir, and some short subjects and minor subjects I was completely relying on Marrow rapid revision videos. Only on rapid revision.
Rapid revision videos. You didn't watch the complete.
No, no, because I had a strong theory foundation during my 4.5 years. Initially, I watched BTR, but I didn't like that the concept of all 19 subjects and all. Later, in the end, I shifted to Dr. Ganga's Master Medicines, where she used to make the concepts very concise and very crisp. I used to revise her notes.
I never heard of it. Dr. Gangar,
Master Medicine.
Master Medicine. How are your GT scores from start of the preparation till end of the preparation?
First GT which I was given in Marrow was after my NEET PG 2024.
Till the second GT, I guess.
That is second. First GT is the NEET PG. Yeah. That was my first GT. Till the NEET PG 2024, I didn't given any, not even single GTs also. I didn't know what was the like, we should give GTs and all. And after completing my NEET PG, that time I had got only 138 corrects. Then after that, I started giving GTs. Initially, my score was around 101 or 102 corrects, in that range only, like 100, 110 corrects. Gradually, it increased to 128, 129 corrects, 130 corrects as and when I completed my revisions and all.
After how many months?
Like around after 3 to 4 months, it took me to come to 100 questions corrects to 130 corrects. Later, it got stuck there only. Then I thought where I was lacking, whether I was lacking in the revision or solving MCQ skills and all. Then later I came to know that it is not about just reading theory, the same stuff again and again. That is also important, but solving more number of questions and focusing more on PYQs. And one thing is we should make PYQs as your best friend, and you should solve all the three exams PYQs, not just about NEET PG. Even if you are aiming only NEET PG, you should solve NEET PG, AIIMS, and as well as FMG question. Once I solved all these the three examination questions, and then I started giving GTs, it gradually increased to 140, 145, and last my GT score was 152 to 155. Last two GT. It was on June, just 1 month before the exam.
Just 1 month before examination, you got 150 correct.
150, 155 corrects.
And in main examination, how?
In main examination, I got 162 corrects.
162. So
I had attempted all
that.
200 questions. Because NEET PG has only -1/4, we should be aggressive.
Leaving one question can push your rank to the
Yeah.
3000, 4000 back.
And to be frank, I didn't know all 162 questions, right? I know only 150 for sure, and rest all the 12 questions were guessing. That is not like guessing; it's the like art of ruling out the questions. And there were some question wrong also, but at least I'll be in some positive marks. Just 2 months before the exam, I was clear with my revisions. I did around 2 to 3 set of revisions. I had solved all my PYQs and all. And I started making that time 20th notebook, the one they were, what they will call like writing all the subjects. In that 20th notebook, I used to write only the things which I used to forget. And it is important for exams, like facts, staging, and some important drug of choices and all. And suppose if I'm studying some glycogen storage disorders, I used to make one table and one chart, so that in the end, last 1 week or last 10 days revision, what they will call, I used to revise that same thing only. And last 15 days, you should make one set of revision in last 15 days. That time I used to revise my whole that 20th notebook again and again. Maintaining mental peace is the game changer during last 15 days, and even last day also. Till I mark the 200th question, preparation won't be complete. Like this preparation starts once you enter the medical field. From the first day you enter the anatomy dissection hall, till you mark your 200th question. Till that time, you should maintain your mental sanity.
That's a long
Uh,
period.
uh,
And what were you aiming? Which rank you were aiming?
I didn't know that whether I'll get in top 5,000 or top 10,000 or top 2,000. It was all about my consistency, and it was all about journey I had enjoyed. I didn't thought that I should get top 200, top 1,000, top 2,000 like that. I had got the rank of 2,000. The only focus was to give my best.
Okay. After the examination, did you hoping for this rank?
No, really not. Not that.
So it was very
Surprise.
according to you.
Yes, and it was a surprise for me. I was in a Maharashtra tour that time.
Okay, you are touring. At the last, which branch you are taking?
I was interested. I'm interested in general medicine, internal medicine.
You are
I'm a,
going to take general medicine.
yes, I'm a diehard physician.
Okay. So why not other branches like radiology, medicine? You might get dermatology also in a good branch. Why not pediatry? Why not other branches? Why only general medicine?
To choose a branch, we should do our internship perfectly. So if you do internship, then we'll come to know whether I will be able to survive in this branch for another 30, 40 years. Whether I will be able to give justice to this branch. We should, that's why we should do the internship properly, so that we'll come to know whether I can do surgicals or non-surgicals. Initially, I ruled out surgical branches. Then options left for me was medicine, pediatric, psychiatry, dermatology, and radiology.
You are interested to take medicine from the beginning, or you were having some other branches in the mind just before the examination. Then you got a good ranking just because you got good ranking. Then you are now hoping for a general medicine. What was your thought before the examination, and now?
No, just before starting my preparation, I thought if I'm going for NEET PG, I should do general medicine or just plain MBBS. No other branches at all.
At the end, what do you want to tell the people who are preparing for the NEET PG 2026?
Don't chase perfection, choose progress. If we run behind perfection, see, nobody is perfect in this world. If you go on mastering in one subject, it takes around minimum 10-15 years. Even that, we can't do mastery in one subject. So choose the progress. At the end, destiny.
destiny plays a huge
Yes,
role.
yes, yes. And enjoy the process.
Enjoy the process, but it's very tiresome to enjoy. Okay, that's the end of the podcast. If you have any questions, I'll be available on Instagram, and Vishwa is also available in the Instagram.
Yeah.
What is your Insta ID?
Dr. V.S. Gowda.
VS Gowda. So if you have any questions, you can ask him questions. Otherwise, you can ask in the comment box also. Kindly like, share, subscribe.
Yes.
Thank you for watching.
Thank you, Dr. Jagdeep, for inviting me. It's a great honor and it's my pleasure.